Hey y'all, Dr. T, just being live. I mean, that's what I'm doing. I'm just gonna be live right now and be real. Now, the reason that this is titled Let's Talk About Sex is for a couple of reasons. One, it's a good grabber. But two, I actually want to talk about sexual health. And because sexual health, hormones and what I do for a living our sexual health is a big part of that. And I think part of living a long, healthy, productive life is having partnership and sexual health. We know that people who have partners and good sex life actually live longer. You've got hormones like oxytocin and dopamine involved, and it's just a feel-good thing. So one of the things I wanted to talk about was for women is sexual health and how pelvic pain can play a role in sexual health. And not just pain from things like endometriosis or scar tissue or previous C-section, whatever, but pelvic pain or dyspareunia from what's called vulvodynia. And vulvodynia is when it hurts upon insertion. And then what happens is you get into this horrible cyclical pattern of it hurts to have sex. So when he's coming at you, what do? You brace for impact. And when you squeeze your butt and you narrow the vagina and you're dry because you're afraid of pain, it just starts the whole cycle again. And so it just constantly gets worse and worse and worse. And so a couple of things. One is if you knew that you were going to go somewhere and somebody was going to punch you in the face, you probably wouldn't go. But when women have pain with sex, especially when they're in a committed relationship, they kind of feel like they should still participate in the endeavor because they feel like they're not doing their duties as a partner or wife. And nothing could be worse. I mean, if you have pain with intercourse, nothing could be worse psychologically and emotionally, not to mention physically, than having somebody on top of you hurting you. That is just not ever going to set up a healthy sexual relationship long term. So if you're having issues where it hurts insertional or it hurts deep when you have sex, something might be up and you need to go get evaluated. But one of the things I wanted to talk about that could be hormonally based is vaginal dryness and thinning of the vaginal mucosa because of hormone imbalances, because of age, just from pain responses. Some women can't take hormones because they have a history of breast cancer. And there's something that is available right now called Jolva. It's vulva with a J. And it's made by a really good friend of mine, Anna Quebeca, who is now currently living in Dallas, I've come to find out. Jolva is a combination of many herbal products. I can't remember the name of the rose that she personally not discovered, but she discovered this and put it into her formula. It also contains 6.25 milligrams of DHEA, which has been researched extensively and found to increase vaginal moisture and strengthen the tissues. And it can help with vaginal pain during intercourse. So it's something to look at. We'll be posting a link to Jolva. I think it's a great product. I put a lot of women on Jolva. I've also put women on hyaluronic acid gels that are made at a compounding pharmacy here in town. But here's what I like to tell my patients when they come in. If you have pain during intercourse, number one, you don't have to have intercourse, okay? So let's just put that out there. If you're having issues, back up and let's figure it out, because the more that you continue to have sex, when it hurts, it's going to hurt more. And then what are you going to do? Your brain's going to associate sex with pain, and then you're never going to want to have sex again. So that's not particularly healthy. So what I like to do is what I call the 30-minute rule. So for 30 minutes, he can do whatever he wants to you, but there's no penetration at all. So kissing, touching, massaging, this could be torture for guys. But hey, if he's going to look for the golden pot, no pun intended, at the end of the rainbow, then he needs to participate. And so he needs to find places on you that feel good, that maybe he didn't know about before, and just kind of touch you, but you don't have the fear that there's going to be pain involved. And for 30 minutes, it could be really pleasant. You can light candles. He can give you a massage. There's all kinds of things that you can do in those 30 minutes, but you don't have the fear of penetration. What that does is a couple of things. One is you can relax. Two is that you are reprogramming, you're getting biofeedback of him touching you, and it doesn't hurt, which is what we're trying to do, is reprogram the brain so that you don't hurt when you're feeling touch. And so that's one thing. And then when you get comfortable with that, when you're wanting to let him graduate, as it were, and you're okay having sex, I always recommend having him sit in a chair and you sitting in his lap face to face. A couple reasons. One is you can control the depth, the tempo, and things like that. You're not necessarily going to hurt yourself. So you're going to control things. You're in a much more controlling posture being on top. When he's sitting in a chair like that, he can't really move around either. So you're in a commanding position and you're not going to hurt yourself. You're already a little bit more relaxed because of the 30-minute rule, and it can kind of ease you back into things. The problem with men, well, one of the problems with men, I would point myself in that group, obviously, is that we're dumb. Well, we're basically dumb. We're dumb people. We get excited and the caveman brain switches on, and the caveman really, and I'm speaking in general terms, I'm sure there's a non-caveman brain man out there somewhere, but we think if we come up to you in the kitchen and we start kissing your neck and rubbing your back, that you're all of a sudden just gonna want us because we're so desirable. So you have to teach us what feels good, what doesn't feel good. You know, sometimes, like, I posted something up about Betty White saying how vaginas can take a pounding, but that's not necessarily a good thing. So men need to learn. We need to learn what feels good. We need to learn how to make you relaxed. And part of the problem is, instead of coming up to you in the kitchen and making a move, maybe we should do the dishes or do the laundry and tell you to go take a nice bath and relax. We got it. We're taking care of things. I'll get the kids homework. I got dinner, whatever. But instead, we think we're going to pull out some of our MacGyver moves that you haven't seen in 15 years since we've been married, and you're just going to want us. The other thing that men don't realize is that the sexual response for women isn't simply waking up with an erection, obviously. The first step in the sexual response is arousal. And if you're suffering from pelvic pain with intercourse, it's really hard to become aroused because it's going to hurt. And like I said, we are programmed to put our hand, or to pull our hand away from the hot stove. We're not programmed to keep going. And so naturally, you're going to shy away from pain, which is a normal response. So don't think that there's anything wrong with you. And then men are also good about saying things like, well, don't you love me? I mean, you know, yeah, I'm getting a little fat, but do you not love me? And then they tell you that it must be something wrong with you because obviously it's not us. So that's when women come in to get their hormones checked, thinking that there's something wrong with them. But if you talk for a while, you can pick up things like, yeah, it does hurt sometimes when I have sex, or it just doesn't feel right, and I'm drier, and that's all things that that can help understand talking through things, making sure things are enjoyable for everybody involved. And I've often said this before. If you want a man sometimes to understand that how it feels when you have pain during intercourse, tell him this. Say, okay, we'll have sex, but I'm going to take a pencil. I don't have a pencil. Well, I do. I have a pen. So I'm going to take this pen, and we're going to count how many times you thrust during sex. And when we're done, some guys are going to be probably 3 times, and some guys will probably be a couple hundred. But every time you thrust, I'm going to take this pen, and I'm going to tap it on your testicle for however many times you thrust and it was hurting me. Now, guys, we're pretty tactile. We can understand that's the ovaries and the testicles have very similar sensations. They're the same organs for the most part. They just produce different hormones. If you tell a guy if you came up to your honey and you said, "Baby, I love the way you're doing those dishes for me tonight. I think I want to have sex with you." Now, in his mind, if he thinks sex is going to be you tapping him on the testicles with a pencil, he's probably not going to want to do that. Men, we need to be talked to, kind of break it down. You got to break it down a little bit simpler for us sometimes. But the good news is it can usually be fixed. There are things that can be done. Pelvic floor physical therapy. There's a great people here, Mary Cromarta and Amy Beth Hopkins are friends of mine here, and I've never sent somebody to a physical therapist that has not gotten better. They always get better. The vaginal dryness, if that's an issue, can be helped with simple creams like Jolva. Reprogramming or biofeedback with your partner, sexual therapy. There's some great Instagram accounts here in Austin, like That Sex Chick. She does some great work. There's a lot of resources out there for women right now. So I just wanted to pop on and talk about sexual health. It's not something that I've ever kind of really talked about here online, but I do see it a lot in the office. I would probably say 20% of the women I see have some sort of sexual dysfunction, whether it be pain or vaginal dryness or something along those lines that then translate into libido issues. So, and I know from my hormone quiz that decreased libido and testosterone issues are the number one hormone imbalance that I see across the board in all age groups. So another reason to potentially get your hormones checked. So I just wanted to swing by and say hello. I'm going to clean. Tomorrow I'm flying out to Phoenix and Tucson so I can teach some other doctors about the great procedure for fibroids called Accessa. I was in Houston this morning. I'm going back to Dallas and San Antonio next week. Oh, Lord. Okay, I probably need to go to bed, but I got to do some laundry. So if anybody's free and they got nothing to do tonight and they want a glass of wine, you can come do my laundry, because I hate doing the sheets, because the fitted sheet, who made fitted sheets, and how do you get those on the bed without feeling like you just did CrossFit? There's got to be a better way to put the fitted sheet on the bed, and if anybody knows, please let me know. I hope y'all are having a good week. Take care.